And so once again, you went to the clinic. And while you were at the clinic, you were told that you needed to get a pap smear done, seeing as how you're a woman in South Africa in the ages of 20 and 50 years old. So now you're wondering, what is a pap smear? Well, you're in luck. Today I'm going to explain. A pap smear is a screening test used to screen for cervical cancer. Cervical cancer is a cancer that occurs right at the mouth of the uterus, on the cervix. So going into the womb, there's a little area that we call the cervix. And cervical cancer grows in that area, usually driven by things like the human papilloma or HPV virus. The pap smear is basically a sample that is taken from that area. Nurses or a doctor, a practitioner of some kind, will use a device we call a speculum to open up the vaginal canal so that they can see to the uterus. When they see the mouth of the uterus, the cervix, they inspect it to see that it looks normal. And if it looks normal, they then take a small brush which they scrape along the inside of the mouth of the womb, and then take that sample that they scraped along and place it on a slide. These slides are then examined under a microscope. They are classified according to a certain classification called the Bethesda classification. And based on that classification, further treatment may be offered to you. It is generally recommended in this country that a woman receive her first pap smear by the age of 30, as long as she is older than 20. The pap smears will then be done recommendedly at least 3 times across the woman's lifetime at age 30, 40, and 50. Though if there are abnormalities, the pap smears may then be done every year to every 2 years, depending on what is found. Pap smears are a great tool. It's relatively pain-free, though there may be a bit of discomfort when they're using the speculum, but otherwise it's relatively pain-free and doesn't cause any real damage to the body. Therefore, pap smears are a great way to screen for these cancers and a great way to know more about your health. Highly recommend that you receive your pap smear if you have not done so. If you are older than 20, you should consider seeking the clinics and seeking a pap smear.